The photocopier's ozone smell cut through the basement archive room as I counted my fourth breath watching Regional Director James Hoffman flip through my performance review without reading a single line. His Italian leather shoes never touched the concrete floor he balanced on the balls of his feet, like the basement air might contaminate his quarterly bonus. "We're restructuring the claims analysis department," he said, finally looking up from papers he'd clearly never read. "Your position is being eliminated for efficiency." I kept my hands folded on the metal desk between us. 7 years of muscle memory had taught me exactly where to place my fingers so the fluorescent light wouldn't catch my wedding ring, the one David had bought from 3 paychecks of his janitor's salary before the diagnosis, before the medical bills, before I'd started keeping detailed logs of every claims decision, every policy interpretation, every Tuesday morning meeting where the real decisions got made. "I understand," I said. His Mont Blanc pen, the same one I'd seen him use to sign 47 claim denials in the past 3 months, scratched across the termination paperwork. The same pen that had approved his own nephew's experimental treatment claim in 8 business days. Tommy Martinez's identical claim had been pending for 6 months. "Your last day is Friday. HR will handle the transition." The archive room's fluorescent tubes hummed their familiar tune. I'd spent 3 years down here supposedly organizing old files, actually learning the rhythm of every system in this building. Tuesday mornings, the executive elevator made an extra stop at the 3rd floor, never logged, never acknowledged. Tuesday afternoons, claim approvals spiked by 37%, but only for specific zip codes. Tuesday evenings, Hoffman's badge accessed the building after hours when the automatic backup systems captured every keystroke. "Mr. Hoffman," I said, "I'd like to request a formal review of this decision." He was already standing. "That's your right, Mrs. Chen. Good luck." The heavy door clicked shut behind him, leaving me alone with the photocopier's hum and a 7-pound folder I'd been building since my first week on the job. Inside that folder was a pattern no one else had bothered to see. I opened my desk drawer and pulled out my phone. David's last text was still on the screen. "Dr. Peterson says we can start the new treatment if insurance approves it by next week. Love you." The treatment that had saved Hoffman's nephew. The treatment Tommy Martinez would never receive. The treatment my husband needed before the cancer spread beyond what any medicine could touch. I dialed extension 4847, Maria Gonzalez Facilities. "Maria, it's Sarah from Claims Analysis. Could you help me with something?" Maria had been the night cleaning supervisor for 11 years. She knew every corner of this building, every locked door, every executive bathroom where the real conversations happened. More importantly, she'd been the one to find Tommy Martinez's son crying in the lobby last month while his father filled out bankruptcy paperwork in the financial aid office. "What do you need, honey?" "I need to know about Tuesday meetings, the ones that aren't on any calendar." The pause stretched long enough for the photocopier to complete its warm-up cycle. "3rd floor conference room," Maria said quietly. 7:30 a.m. every Tuesday for 18 months. I dust those tables every Wednesday morning. They leave coffee rings. Who attends? Mr. Hoffman, Ms. Patterson from legal, Dr. Yates from medical review, and someone I don't recognize, expensive suit, never leaves his name in the visitor log. My pulse quickened. Dr. Patricia Yates was the chief medical officer, the final signature on complex claim denials. Ms. Catherine Patterson had written the policy interpretation guidelines that somehow never applied consistently, and the expensive suit could only be one person. "Maria, I need a favor, a big one." "What kind of favor were to do one?" "Certain in my one. The kind that might help Tommy Martinez get his father's treatment approved." Another pause, then, "What do you need me to do?" That afternoon, I sat in my car in the employee parking lot, watching Maria's cleaning cart disappear into the service entrance. She'd agreed to leave the 3rd floor conference room unlocked tomorrow morning. She'd also agreed to make sure the room's audio system was set to record a feature most executives forgot existed. My phone buzzed, a text from my sister Jennifer. "How's David doing? Mom's worried." I stared at the message for 30 seconds before typing back, "Treatment gets approved or it doesn't. We'll know soon." What I didn't type, I've spent 3 years learning how this place really works. I know which claims get approved and which get buried. I know whose medical files get priority review and whose disappear into pending status. I know about the Tuesday meetings, the off-books consultants, the selection criteria that have nothing to do with medical need, and everything to do with zip codes, demographics, and quarterly profit margins. What I couldn't yet prove was the connection between those Tuesday meetings and the 47 denial letters I'd processed for identical cases that got approved somewhere else in the system. But I had 18 hours to find out. Tuesday morning arrived gray and humid. I'd been in the building since 6 a.m. using my analyst access to pull claim files from the past year. By 7:15, I was positioned in the supply closet adjacent to the third-floor conference room, listening to Maria's vacuum cleaner disappear down the hallway. At 7:28, the conference room door opened. "Coffee's already set up." Hoffman's voice carried clearly through the thin walls. "Good." A woman's voice, Patterson from legal. "Dr. Yates is running late, but we can start without him." Footsteps crossed the room. Chair legs scraped against hardwood floors. "How many this week?" A third voice, unfamiliar with the crisp articulation of someone who'd never waited in a claims processing line. 43 pending reviews, Hoffman said. "Most are straightforward denials. A few need more finesse." Define finesse. "Cases where a quick approval might prevent legal challenges. Better to approve the treatment than fight a discrimination lawsuit." Papers rustled, coffee cups clinked against saucers. "What about the Martinez case?" Patterson asked. "Still pending. Families exhausted their appeals. They'll give up or find alternative funding. And if they don't, medical necessity is subjective," the unfamiliar voice said smoothly. "Dr. Yates can find reasons to deny any treatment if the optics require it." My hand was cramping around my phone's voice recorder. The audio quality through the wall wasn't perfect, but it was clear enough. "The Chen woman," Hoffman continued. "We terminated her yesterday. She was getting too familiar with the filing systems. Good. Anyone else showing curiosity about approval patterns?" "Not yet. Most analysts only see their assigned cases. They don't have access to the full database." They were wrong. I'd been cross-referencing cases for 3 years, building spreadsheets that tracked approval rates by demographics, by zip code, by attending physician, by requested treatment cost. The patterns were unmistakable once you saw them from above. At 7:45, Dr. Yates arrived. "Sorry I'm late. Emergency surgery ran long." His voice was younger than I'd expected, professional but tired. "We were discussing this week's review queue," Patterson said. "Right, I've got the files here. Most of these are clear-cut denials, experimental treatments, elective procedures, non-essential therapies." "What about the Hoffman case?" the unfamiliar voice asked. "Which Hoffman case?" "James's nephew, the leukemia treatment." "Oh, that one, already approved. Standard protocol for that type of aggressive therapy." "And the Martinez case, identical diagnosis, same treatment protocol. Different circumstances," Dr. Yates said, but his voice had changed. Less confident. "The patient's overall health profile suggests lower success probability." "Lower by how much?" "Wunar." A pause. It's more complex than simple statistics." Dr. Yates, Patterson's voice carried a warning. "Medical review decisions need to be defensible." "They are defensible. The Martinez patient has comorbidities that reduce treatment efficacy." "What comorbidities?" Another pause, longer this time. "I'd need to review the file more thoroughly." "The file you approved for denial yesterday?" "Yes." Without reviewing it thoroughly, ihenom. The conference room fell silent except for the building's air conditioning cycling on. I checked my phone's recording time, 22 minutes. "Gentlemen," Patterson said finally, "I think we need to discuss our review protocols more carefully." Meaning we need to ensure that similar cases receive similar treatment regardless of external factors. External factors, family connections, geographic considerations, insurance tier status. Hoffman's voice defensive now. "Our approval rates meet industry standards." "Industry standards aren't the issue," as the unfamiliar voice said. "The issue is consistency. If identical cases receive different outcomes, we're exposed to discrimination claims." "Are you suggesting we change our approach?" "I'm suggesting we document our rationale more carefully. And I'm suggesting that Dr. Yates might want to reconsider any decisions made without thorough file review." Chair legs scraped again. Coffee cups clinked. "Dr. Yates," Patterson said, "how long would you need to conduct a complete review of pending cases to ensure consistency in your medical necessity determinations?" "A complete review of how many cases, all denials from the past 6 months where similar treatments were approved for other patients." Silence stretched for 15 seconds. "That would take weeks. Then you'd better get started." More chair scraping. The meeting was ending. One more thing, the unfamiliar voice said. The Chen termination. Make sure all her files are transferred properly. We don't want any gaps in documentation. Already handled, Hoffman said. They were wrong about that too. My files were transferred, but my spreadsheets, my cross-reference databases, my pattern analysis, those lived on my personal laptop and a secure cloud drive David didn't even know about. The door opened and closed. Footsteps disappeared down the hallway. I waited 5 more minutes before slipping out of the supply closet and heading back to the basement. My termination wasn't effective until Friday. I still had 3 days of legitimate building access, 3 days of database privileges, 3 days to build an airtight case. But first I needed to understand exactly who was in that conference room. That evening, I called Maria from my car in the hospital parking lot. David was inside getting his weekly blood work, the results that would determine whether he had 2 weeks or 2 months left for treatment to be effective. Maria, it's Sarah, the man in the expensive suit, the one who doesn't sign the visitor log. Have you ever seen him anywhere else in the building? A few times. Always with Mr. Hoffman. Always after regular business hours. Yeah, where? Executive parking garage. They meet by the elevators, never go upstairs together. Any idea who he is? Maria was quiet for 30 seconds. Honey, you know I clean the executive offices every night. Yes. Mr. Hoffman's office has family pictures on his desk. Wife, kids, nephew in a hospital bed. I've seen those. But he also has business cards in his top drawer. I accidentally knocked them over last week when I was dusting. What kind of business cards? Medical consulting firm. Phoenix Strategic Healthcare Solutions. The name on the card was Richard Morrison, Senior Medical Advisor. Richard Morrison. The expensive suit had a name. Sarah, whatever you're planning, be careful. Mr. Hoffman gets angry when things don't go his way. How angry? Last month, one of the claims processors questioned a denial that didn't make medical sense. She was transferred to a different department the next day. What happened to her? She quit 2 weeks later. Said the new position was impossible to succeed in. After hanging up, I sat in the parking lot researching Phoenix Strategic Healthcare Solutions on my phone. Their website was professionally vague, optimizing healthcare delivery through strategic cost-benefit analysis and medical necessity consultation. Their client list included 12 major insurance companies. Their methodology promised evidence-based efficiency improvements that reduce unnecessary medical expenditures while maintaining quality care. Their founder and CEO was Richard Morrison, former insurance executive with 23 years of experience in medical cost optimization. The company had been hired by Pinnacle Insurance 18 months ago, exactly when the Tuesday meeting started. David emerged from the hospital looking exhausted. How did it go? I asked as he got in the car. Dr. Peterson wants to start treatment next week if possible. The blood work shows the cancer is progressing faster than expected. How much faster? 2 weeks, maybe less, before the treatment window closes. I started the engine and pulled out of the parking lot, my mind racing through timelines and possibilities. 2 weeks to build a case that would normally take months to investigate. 2 weeks to expose a systematic discrimination pattern that had been carefully constructed over 18 months. 2 weeks to save my husband's life and 46 other people's lives that had become numbers in a cost-benefit analysis. Sarah, David said quietly, what aren't you telling me? I think I know why your treatment hasn't been approved. And it costs. And I think I know how to fix it. Wednesday morning, I was back in the basement archive room by 6 a.m. using my remaining database access to build the most comprehensive documentation of discrimination I could assemble in the time I had left. First, I pulled every claim file from the past 18 months that involved experimental or expensive treatments. The pattern was immediately obvious. Claims from zip codes with median household incomes above $85,000 had an approval rate of 73%. Claims from zip codes below that threshold had an approval rate of 35%. For identical diagnoses, identical treatment protocols, identical medical necessity criteria. But the geographic discrimination was only the first layer. I cross-referenced approval times with patient demographics. White patients received approval decisions an average of 12 days faster than Black patients. Male patients received approval decisions 8 days faster than female patients. Patients with employer-sponsored insurance received approval decisions 15 days faster than patients with individual marketplace plans. The photocopier hummed while I printed everything, page after page of statistical evidence that painted a picture of systematic discrimination so clear that no reasonable person could deny it. But statistics weren't enough. I needed names, faces, stories. I started with Tommy Martinez. His father had worked construction for 38 years before the diagnosis. No criminal record, steady employment history, perfect payment record on his insurance premiums. His leukemia was identical to the type that had affected Hoffman's nephew, same genetic markers, same progression rate, same treatment protocol recommended by the same oncology specialist. Hoffman's nephew had been approved for treatment in 8 business days. Tommy Martinez's father had been denied 3 times over 8 months, finally dying, while the 4th appeal was under review. Next, I found Maria Vasquez, a 64-year-old teacher whose breast cancer treatment had been denied as experimental the same week that identical treatment was approved for the wife of a Pinnacle Insurance board member. Maria had used her retirement savings to pay for treatment privately. The board member's wife had received the same treatment fully covered, including transportation and lodging expenses for out-of-state specialists. Then Dr. Angela Williams, an ER physician whose daughter's rare genetic disorder required enzyme replacement therapy costing $400,000 per year. The treatment had been denied as not medically necessary, despite overwhelming evidence from pediatric specialists. 3 weeks later, an identical case involving a pharmaceutical executive's son had been approved immediately, with Pinnacle Insurance issuing a press release about their commitment to covering innovative treatments for rare childhood diseases. By noon, I had documented 17 cases where identical treatments had been approved for wealthy or connected patients while being denied for working-class patients. The pattern was so consistent that it couldn't possibly be coincidental. The archive room's fluorescent lights flickered as I compiled the final spreadsheet. 47 denied claims. 47 families who had exhausted their savings, mortgaged their homes, or simply accepted death rather than continue fighting an insurance system designed to crush them through bureaucratic attrition. But I still needed proof of intentional discrimination, not just statistical disparity. I needed the Tuesday meetings. That afternoon, I called Maria. "I need another favor," I said. "Sarah, this is getting dangerous. Mr. Hoffman has been asking questions about cleaning schedules, about who has access to executive floors." "What kind of questions?" "Whether anyone has been in areas they shouldn't be. Whether I've noticed anything unusual in the conference rooms." "What did you tell him?" "Nothing. But I think he suspects something." "Maria, I need recordings of the next Tuesday meeting. Just one more." "Why, AB?" "Because my husband is going to die if I can't prove that treatment approvals are being manipulated for profit instead of medical necessity." The phone was quiet for nearly a minute. What do you need me to do?" "Same as before. Leave the conference room unlocked, make sure the audio system is recording. And after that, after that, you pretend you know nothing about any of this." What if they find out?" "They won't. I'll make sure of it." Thursday morning, I was positioned in the supply closet again at 7:15. The conference room door opened at exactly 7:30. "We have a problem." Hoffman's voice was tense. "Someone's been asking questions about approval patterns." "What kind of questions?" Patterson asked. "Statistical analysis questions, geographic correlations, timeline comparisons." "From whom?" "It's unknown. But our IT department flagged unusual database access patterns over the past week." "The Chen woman." Morrison's voice was sharp. "Her access should have been revoked." "It was revoked. This is someone else." "Who are the Churum?" "Rainmano." "We're investigating." Morrison spoke again. "We need to accelerate our timeline. Any pending denials that could create exposure should be resolved immediately." "When?" "What kind of resolution?" "Approve the ones that might generate legal challenges. Deny everything else permanently so the families stop appealing." "How many are we talking about?" 73 pending cases. I've categorized them by risk level." Papers rustled. Coffee cups clinked nervously. Green light means immediate approval. Yellow means delayed approval with additional requirements. Red means permanent denial with medical language that prevents further appeals. How many red cases? 41. 41 families who will lose coverage permanently. 41 cases that pose financial risk to the company. Dr. Yates spoke for the first time. "Some of these red cases are medically urgent. If we deny them permanently, people will die." "Dr. Yates," Morrison's voice was ice cold. "People die every day. Our job is to ensure they don't die on our dime unless legally required. That's not medical ethics. Medical ethics don't pay your salary. Silence stretched for 20 seconds. Dr. Yates Patterson said finally, "Are you comfortable with the risk categorization system?" "No, Mom." "Are you willing to implement it anyway?" Another pause. "What if I refuse?" "Then you'll be replaced by someone who understands business priorities. And if I cooperate, then you'll receive the performance bonus discussed in your contract review." "How much?" $200,000 plus stock options. The room fell silent except for air conditioning and my own heartbeat. "Dr. Yates," Morrison prompted, "I need the weekend to think about it." "You have until Monday morning. The risk categorization needs to be implemented by Tuesday. And if I'm not comfortable with specific cases, then you'll make them someone else's problem." Phoenix Strategic has backup medical reviewers who are very comfortable with necessary business decisions. Chair legs scraped. The meeting was ending early. "One more thing," Hoffman said. "Security is investigating the database access irregularities. If anyone approaches any of you with questions about approval processes, refer them to legal immediately." "What if it's law enforcement harm?" "It won't be. But if it is, you know nothing about risk categorization or Tuesday meetings. These conversations never happen." Footsteps crossed the room. The door opened and closed. I waited 10 minutes before leaving the supply closet, my hands shaking as I stopped the recording. 41 people were going to die so Pinnacle Insurance could avoid financial risk. My husband was almost certainly one of them. Thursday evening, I sat in my car outside David's oncology appointment, listening to the recording again and building a timeline in my mind. Morrison would return on Monday with the final risk categorization. Dr. Yates would either cooperate or be replaced. By Tuesday, 41 families would receive permanent denial letters written in medical language designed to prevent further appeals, unless someone stopped it from happening. I called Jennifer. "Sarah, how's David?" "Not good. The treatment window is closing." "Oh, honey, I'm so sorry." "Jennifer, I need you to call Amanda Kim at Channel 7 again. The investigative reporter, tell her I have recordings of insurance executives discussing a plan to permanently deny life-saving treatments for 41 people to improve quarterly profits." "Sarah, this is huge." "Tell her I have statistical evidence of systematic discrimination in medical claim approvals, including approving identical treatments for wealthy patients while denying them for working-class patients." "How long have you been working on this?" "Doreen Mainon." 3 years, but it all comes together on Monday." What happens Monday? Either I expose the biggest medical discrimination scandal in state history, or 41 people lose their last chance at life-saving treatment, including David. Serena is Turkin. "Including David." Jennifer was quiet for 30 seconds. "What do you need me to do?" "Set up a meeting for tomorrow afternoon. Tell Amanda Kim to bring a camera crew and her legal team." "Sarah, are you sure about this?" "I've never been more sure of anything in my life." Friday morning, my official last day at Pinnacle Insurance. I spent 4 hours copying every piece of evidence I'd compiled onto multiple USB drives, statistical analysis patient case files, recorded meetings, geographic discrimination data, timeline correlations between Tuesday meetings and approval decisions. By noon, I had 6 identical sets of evidence that could independently prove systematic discrimination in medical claim approvals. At 2 o'clock, I cleaned out my desk for the final time, taking only personal items and leaving everything else exactly as company policy required. At 3 o'clock, Amanda Kim met me at the same coffee shop where we'd first discussed the story. "Mrs. Chen, I've been thinking about our conversation all week. Do you really have evidence of intentional discrimination?" I handed her a USB drive. 18 months of recorded executive meetings where they explicitly discuss manipulating medical reviews for profit. Statistical analysis proving that identical treatments get approved or denied based on patient demographics. Documentation of 41 cases where people will die next week, so the company can improve quarterly earnings. Amanda Kim plugged the drive into her laptop. For 15 minutes, she reviewed spreadsheets, listened to audio clips, and took notes. Finally, she looked up. "Mrs. Chen, this isn't just a story. This is criminal fraud. This is conspiracy. This is going to destroy the company." "Good. Are you prepared for the consequences, legal challenges, depositions, death threats from people who lose money when the stock crashes? Are you prepared to let 41 people die so insurance executives can buy bigger yachts?" Amanda Kim closed the laptop. "When do you want to run the story?" "Sunday night, before the Monday meeting where they finalize the death list." "Death list, your Shibon. That's what it is. 41 people categorized as acceptable losses for business optimization. Mrs. Chen, I need to ask you directly, is your husband one of the 41? Probably. And you're willing to go public with this story, even if it means retaliation against your family. I'm willing to go public with this story because retaliation against my family has already been happening for 18 months. The only difference is now I have evidence. Amanda Kim was quiet for a long moment. I'll need the weekend to verify everything independently and prepare the broadcast. Can you be available for an on-camera interview Sunday afternoon? Yes. And Mrs. Chen, after this story runs, your life is going to change permanently. My life changed permanently the day my husband got cancer, and I realized our insurance company was more interested in profit margins than human lives. Sunday morning, I helped David organize his medications and drove him to the hospital for what might be his last round of pre-treatment blood work. We'd received no word about insurance approval, no response to our appeals, no indication that Pinnacle Insurance had any intention of covering the treatment that could save his life. Sarah, David said as we sat in the oncology waiting room, I need to tell you something. What at tea? If the treatment doesn't get approved, I'm okay with that. What do you mean? I mean, I'm proud of what you've done. Fighting for people who can't fight for themselves. Building evidence instead of just getting angry. Trying to change the system instead of just beating it. David, I'm proud to be married to someone who kept receipts for 3 years, just in case she needed to save 41 strangers' lives. I started crying in the middle of the hospital waiting room. Mrs. Chen, a nurse appeared beside us. Dr. Peterson would like to see you both. In Dr. Peterson's office, David's test results were spread across the desk like a roadmap to an uncertain future. The good news, Dr. Peterson said, is that your blood work shows you're still a candidate for the treatment. And the bad news, Shaikuram. The treatment needs to start within 72 hours to be effective. After that, the cancer will have progressed too far. What about insurance approval? No word yet. But Mrs. Chen, there are other options. Clinical trials, compassionate care programs, medical tourism. How much would those cost? Between $50,000 and $200,000 depending on the approach. I looked at David. We had $347 in our checking account and a mortgage that already consumed 60% of his disability payments. Dr. Peterson, I said, what happens if we can't afford any of those options? Then we make you as comfortable as possible for as long as possible. David squeezed my hand. How long? 8 to 12 weeks. Sunday afternoon, Amanda Kim's news crew set up cameras in our living room. I sat across from her at our kitchen table, the same table where David and I had paid medical bills every month for 2 years, the same table where I'd built spreadsheets proving that insurance companies systematically discriminated against people like us. Mrs. Chen, Amanda Kim said when the cameras were rolling, tell me how you first discovered the discrimination pattern at Pinnacle Insurance. I noticed that approval times varied dramatically for identical cases. At first, I thought it was random variation or different medical reviewers having different standards. When did you realize it was systematic? When I started tracking approvals by zip code, wealthy neighborhoods had approval rates almost twice as high as working-class neighborhoods for the same treatments. How did you document this? 3 years of database analysis, cross-referencing thousands of cases by demographics, geography, family connections, insurance tier, status treatment cost, and approval timeline. And what did you find? Systematic discrimination. Identical treatments approved for wealthy or connected patients while being denied for everyone else. Including your own husband's case. Including my husband's case. Amanda Kim leaned forward. Mrs. Chen, you recorded executive meetings where Pinnacle Insurance managers discussed manipulating medical reviews. Can you tell us what you heard? I heard them categorize pending cases by financial risk instead of medical necessity. Green light for immediate approval, yellow light for delayed approval, red light for permanent denial. How many red light cases? 41. 41 people who will be denied life-saving treatment so the company can improve quarterly profits. People who will die. People who will die. Mrs. Chen, why are you going public with this information? Because someone has to keep receipts. Someone has to document what's happening when insurance companies choose profit over human lives. What do you want to see happen? I want every denied claim reviewed by an independent medical board. I want policy changes that prevent demographic discrimination. I want the people responsible held accountable for systematic fraud. And personally, I want my husband to receive the same treatment that was approved for the regional director's nephew in 8 business days. If Pinnacle Insurance retaliates against you for speaking out, they already retaliated. They terminated me for asking too many questions. But you can't retaliate against the truth. After the interview, Amanda Kim packed up her equipment while I made dinner for David. The story runs tonight at 11, she said. Are you ready? I've been ready for 3 years. Mrs. Chen, after this airs, there's no going back. There was no going back the moment I realized 47 people had died while their insurance company optimized profit margins. At 11 o'clock, David and I sat on our couch watching Channel 7's lead story, Investigation Reveals Systematic Discrimination in Medical Claim Approvals. The report included audio excerpts from Tuesday meetings, statistical analysis of approval patterns, and interviews with families who'd been denied identical treatments that were approved for wealthy patients. Amanda Kim's voice narrated over spreadsheets and graphs that painted an undeniable picture of systematic discrimination. Tonight, Channel 7 has obtained evidence that Pinnacle Insurance has been systematically denying life-saving treatments to working-class patients while approving identical treatments for wealthy or connected patients. The story ran for 12 minutes. By the time it ended, my phone was ringing. Unknown numbers, journalists, attorneys, my mother, Jennifer, Maria from facilities. I answered Maria's call. Sarah, are you watching the news? Pini. Yes. Mr. Hoffman called an emergency meeting for 7 a.m. tomorrow. Everyone's panicking. What kind of meeting? Damage control. They're bringing in lawyers and public relations consultants. Maria, you need to be careful. If they suspect you helped with this, I'm 63 years old, honey. I've survived worse than James Hoffman's temper tantrums. After hanging up, I looked at David. What happens now? He asked. Now we find out if doing the right thing was worth it. Monday morning brought unexpected visitors. The doorbell rang at 8 a.m. while David and I were drinking coffee and watching the national news pick up Amanda Kim's story. Through the peephole, I saw 2 people in business suits holding briefcases and badges. I opened the door. Mrs. Chen, I'm Agent Patricia Williams from the FBI's Healthcare Fraud Division. This is Agent Michael Rodriguez from the State Insurance Commission. We'd like to discuss your evidence regarding Pinnacle Insurance. Come in. In our living room, Agent Williams opened her briefcase and pulled out a digital recorder. Mrs. Chen, we've reviewed the audio and statistical evidence you provided to Channel 7. Our preliminary analysis suggests systematic fraud in medical claim processing. What does that mean legally? It means Pinnacle Insurance may have violated federal anti-discrimination laws, mail fraud statutes, wire fraud statutes, and RICO provisions related to systematic criminal enterprise. What about the executives involved? If we can prove intentional discrimination for profit, they face federal charges carrying prison sentences up to 20 years. Agent Rodriguez leaned forward. Mrs. Chen, we understand your husband's treatment is pending approval. Yes. As of this morning, the State Insurance Commission has placed Pinnacle Insurance under emergency oversight. All claim denials from the past 6 months are being reviewed by independent medical boards. Yet what about current pending cases? Expedited review, medical decisions only, no financial considerations. How long will that take? 72 hours maximum. I looked at David. 72 hours was exactly the treatment window Dr. Peterson had given us. What do you need from me? I asked. Complete cooperation, testimony before a grand jury, assistance in analyzing the systematic discrimination pattern. Will I be protected from retaliation? You'll be a federal witness in a major fraud investigation. Anyone who retaliates against you will face additional federal charges. Agent Williams handed me a business card. Mrs. Chen, what you did documenting systematic fraud over 3 years, building statistical evidence, recording executive meetings that took extraordinary courage. It took desperation. Sometimes they're the same thing. Monday afternoon, my phone rang while I was helping David organize his medications for what we hoped would be the beginning of treatment. Mrs. Chen, this is Dr. Elizabeth Morrison from the Independent Medical Review Board. Yes, I'm calling about your husband's treatment authorization. We've completed our review of his case. My heart stopped. The treatment has been approved effective immediately. We've also approved coverage for all related medical expenses, including transportation and lodging if you need to travel for specialized care. Hranson approved assurance. Approved. Mr. Chen should contact Dr. Peterson today to schedule treatment initiation. After hanging up, I sat in our kitchen for 5 minutes, staring at David's pill organizer and trying to process what had just happened. My husband was going to live, but more importantly, 40 other people were going to live too. Tuesday morning, I drove to Dr. Peterson's office with David for his first treatment session. In the parking lot, my phone buzzed with a text from Amanda Kim. Pinnacle Insurance stock down 60%. CEO resigned. Federal investigation expanding to 6 other insurance companies. You started something massive. Inside the treatment center, David was taken to a private room where nurses began the IV infusion that would hopefully save his life. I sat beside his bed holding his hand and watching medicine drip into his bloodstream. Sarah, he said quietly, I need to tell you something. What a one and when. I'm proud of you. Not because you saved my life, but because you saved everybody's life. I didn't save everybody. You saved everybody who comes after us. The next person who gets diagnosed, the next family who gets denied, the next analyst who notices patterns, they'll have protection because you kept receipts. Dr. Peterson appeared in the doorway. How are we feeling? Hopeful, David said. Good. Mrs. Chen, I wanted you to know that 3 other patients started identical treatments today, all approved through the emergency review process. 3 other people. 3 other people who were previously denied the same treatment your husband received. The independent medical board found no justification for the denials. That afternoon, while David rested after his first treatment, I drove to the Pinnacle Insurance building for the last time. The parking lot was half empty. News vans lined the street. Security guards checked IDs at the front entrance. I wasn't going inside, I was going to see Maria. I found her in the employee break room looking exhausted but defiant. Sarah, how's David? Turning him once. Treatment started today, how are you? They questioned me for 3 hours yesterday. Lawyers, executives, FBI agents. What did you tell them? I told them I clean conference rooms and empty trash cans. I don't listen to conversations or keep records of who meets when. Did they believe you? They had to. I've been invisible to executives for 11 years. They can't imagine I know anything important. Maria, I need to thank you. For what? For helping me record those meetings? For taking the risk? Honey, you don't need to thank me. Tommy Martinez's father was a good man. He deserved better than dying while waiting for treatment. He would have been proud of what you did. He would have been proud of what you did. I just opened a few doors. That evening, David and I sat on our couch watching the national news coverage of the Pinnacle Insurance scandal. Federal charges had been filed against James Hoffman, Catherine Patterson, and Richard Morrison. Dr. Yates had agreed to cooperate with federal investigators in exchange for immunity. The State Insurance Commission had announced emergency reviews of claim approval practices at 15 major insurance companies. Sarah and David said during a commercial break, "What are you going to do now, Torwin? What do you mean? For work, for your career." I'd been offered 3 different positions: senior analyst with the State Insurance Commission, healthcare fraud investigator with the FBI, and senior claims advocate with a patient rights organization. I think I want to keep doing what I've been doing. 18, which is keeping receipts, documenting patterns, making sure people like us don't get lost in the system. You know, with which organization? Does it matter? The work is the same everywhere, finding the truth and making sure someone writes it down. 6 months later, David's cancer was in remission. The experimental treatment had worked exactly as Dr. Peterson had predicted and exactly as it had worked for James Hoffman's nephew. I was working as senior healthcare fraud analyst for the Federal Trade Commission investigating systematic discrimination in insurance claim processing across 12 states. The patterns I'd discovered at Pinnacle Insurance weren't unique, they were industry standard. But now there were people whose job it was to notice those patterns. People whose job it was to keep receipts. People whose job it was to ensure that identical medical cases received identical treatment regardless of zip code, demographic profile, or family connections. On a Tuesday morning in November, I sat in a federal courthouse in Washington, D.C., testifying before a Senate committee about systematic discrimination in healthcare coverage. Mrs. Chen, the committee chair asked, "In your professional opinion, how widespread is this type of discrimination?" Senator, based on our investigation of 43 insurance companies across 12 states, systematic demographic discrimination in claim approvals appears to be standard industry practice. How many people have been affected? Our conservative estimate is 200,000 people over the past 5 years who were denied treatments that were approved for demographically different patients with identical medical profiles. 200,000 people. 200,000 documented cases. The actual number is likely much higher. Mrs. Chen, what would you recommend to prevent this type of discrimination in the future? Independent medical review boards for all claim denials above $50,000. Mandatory reporting of approval rates by demographic categories. Criminal penalties for executives who participate in systematic discrimination. And protection for employees who report discrimination patterns. Whistleblower protection. Someone has to keep receipts, Senator. Someone has to notice patterns and document evidence. If we want to prevent systematic fraud, we need to protect the people who are willing to spend 3 years building spreadsheets that prove it's happening. After the hearing, I walked out of the courthouse into crisp autumn air and called David. How did it go? He asked. Good, I think they're going to pass the legislation. The Healthcare Anti-Discrimination Bill. Independent medical review requirements, demographic reporting mandates, executive criminal liability, whistleblower protection, the whole package. That means the next person who notices what you noticed will be protected when they speak up. And the next insurance company that tries to optimize profit by letting people die will face federal charges. Sarah, are you coming home tonight? Flight lands at 7. I'll be home by 8:30. I'll make dinner. We can celebrate. Wes, what are we celebrating? That you kept receipts, that you saved 41 lives, that you changed the system instead of just surviving it. David Uarandawara. Yeah, I love you too. That night in our kitchen, the same kitchen where I'd built spreadsheets for 3 years, David and I ate dinner and talked about ordinary things. His job at the community center, my travel schedule, whether we should refinish the hardwood floors. Normal problems for people who had learned that keeping detailed records could literally save lives. Later, as I was washing dishes, David handed me an envelope. What's this, Sinum? Open it. Inside was a handwritten letter from Tommy Martinez Jr. Mrs. Chen, I wanted you to know that my father would have been proud of what you did, not just because you exposed the insurance company, but because you remembered his name when you testified before Congress. You said that Tommy Martinez Sr. died waiting for treatment that should have been approved in 8 days instead of 8 months. You made sure his death mattered for something bigger than just our family's grief. Thank you for keeping receipts. Thank you for making the system change. My father's name is now part of the federal legislation that will prevent other families from going through what we went through. Tommy Martinez Sr. Healthcare Anti-Discrimination Act. He would have liked that. Sincerely, Tommy Martinez Jr. I stood at our kitchen sink holding the letter and remembering the photocopier's ozone smell, the fluorescent lights humming in the basement archive room, the Tuesday meetings where people's lives were reduced to profit calculations. I thought about Maria's coffee rings on conference room tables, Dr. Yates's uncomfortable pauses, the 47 families who had trusted a system designed to exhaust them into giving up. I thought about the 7-pound folder I'd built over 7 years, not for revenge, but for proof. Not to destroy anyone, but to document the truth until someone was ready to listen. And I thought about David, healthy and whole, helping with dishes in our kitchen on a Tuesday night in November, alive, because someone had decided to keep receipts instead of keeping quiet. The Tommy Martinez Sr. Healthcare Anti-Discrimination Act passed Congress 3 months later with bipartisan support. But by then I was already working on the next case, the next pattern, the next systematic fraud that needed someone to notice it and write it down. Because that's what justice looks like in the real world, not dramatic confrontations or revenge fantasies, but spreadsheets and documentation and the patience to build evidence that no reasonable person can deny. Someone has to keep receipts. Someone has to count the bodies. Someone has to remember their names. And sometimes if you're very careful and very thorough and very patient, you can make sure the counting stops and the system changes, and the next person who gets sick doesn't have to choose between bankruptcy and death. That's not revenge. That's justice. And it starts with keeping receipts.